Hi, my name is Patrick Lukembo, and I'm the director of the UH Wellness Center.
And my name is Ruben Perez. I'm the Assistant Director of the UH Wellness Center, and we're here to talk to you about alcohol and other substances for your risk management training video series. The first thing we're going to talk about is high-risk substance use, the way a person may be drinking that can lead to an unwanted result. And on the list here, you have several ways a person can do that. One is using prescription medication other than as prescribed, which means you're taking a medication that doesn't belong to you and that may interact with your body system other than the way the person is intended for, the medicine is intended for. Underage drinking is another, and you have drinking on an empty stomach. Why would that be high risk? It is because alcohol can get into the bloodstream just like that. And on the bottom is high quantity of short time. High quantity of short time can get a lot of alcohol into a person's system and rise their BAC level faster than they really want to. And the BAC is blood alcohol concentration. What do you think is a drug choice for college students? Yes, alcohol. If you guessed alcohol, that is the correct answer.
So one of the unintended consequences that can come with high-risk drinking is alcohol poisoning. Alcohol poisoning can lead to a medical emergency when the blood alcohol content is too high and the body is not able to take care of all of the alcohol that is in your system. So there's several symptoms for someone that may be poisoned by alcohol. We like to use an acronym, PUBS, to help people remember what these symptoms are. The first P stands for puking. So if someone is vomiting uncontrollably, or if they're even unaware that they're vomiting, that could be one of the first signs that they have alcohol poisoning. The second letter is U, and it stands for unconscious. If someone is unconscious, semi-conscious, or cannot be awakened easily after drinking for a period of time, that may be another symptom of alcohol poisoning. The third letter, B, stands for breathing. If they have low, very shallow breathing, or if it's less than 8 breaths per minute, that's another strong sign that they may be being poisoned by alcohol. Finally, the last letter, S, stands for skin. If their skin is cold, if it's clammy, pale, or even if it's blue, otherwise different than what it might usually look like, that is another strong sign that they may have alcohol poisoning. It's important to know the symptoms of alcohol poisoning because we want you to intervene and help in a situation. Unfortunately, there are a lot of reasons why people don't intervene, and those can actually lead to really bad consequences. So the first reason why people don't usually help is because they don't know the skills to intervene. They may not know the symptoms of alcohol poisoning, they may not know who to get involved, or lack of just not knowing what to do, which is the second bullet. Sometimes people just don't intervene because they just don't know what to do. Finally, the third reason is that a lot of people may not intervene because they think that someone else will do something. So if you are in a situation where someone may have drank too much and you're concerned that they may be exhibiting symptoms of alcohol poisoning, we encourage you to stand up and be that person to help out.
So how can you do that? There's two ways, direct versus indirect ways of helping. Now, the first one, direct an emergency. Take away the keys. You're being direct and you're taking away the keys from a person who may be under the influence. Remove the person from the situation if something's really happening and it's an emergency that's taking place, and then administer CPR if necessary and call 911. Another direct way is a non-emergency type situation. Talk to the person directly about the problem so they know that you know what's going on, and hopefully that your perception will help them make better decisions later on down the line. Indirect an emergency. Have server cut them off. Distract the people involved and list others to help. This is a place where you may not feel comfortable enough to directly go by yourself. So pull someone else in to help you out and distract the people to help get involved. And with the others, a group of people can make a difference. And indirect and non-emergency, ask advice from a professional. If it's a situation that's too much for you, if you know a person that may be in a place that can be addictive to alcohol, addicted to marijuana, addicted to other type of substance, then consult with a professional to get that help. And as a group, set up the risk management guidelines for your organization so you know what to do. What will you do to help your group? That is the question. One is, as an individual within your group, confront the person directly, ask others to help, and call 911 when you suspect an overdose. Just like the indirect and direct, But in your group, as an individual, this is something that you can do. Now, as a group, have a designated non-bystander. Have people at the party or at your function that is there just to be helping out and monitor the situation and monitor the event that you're having. Participate in server training, knowing how to identify individuals that may be under 21 and how to card and do other stuff like that. Discuss group risk and set up a risk management plan and follow it. Make sure you actually follow that plan and get your group together to talk about each event before you start the event.
We want you to know that you're not alone. There are fantastic campus resources that can help you throughout all of these situations. The first we want to mention is the office that Ruben and I represent, University of Houston Wellness. We're located on the first floor of the Campus Recreation and Wellness Center and are the preeminent health education office on campus. You can come visit us, talk with a staff member, get some information, or we're even willing to do outreach and do workshops or presentations for your group. The second are our counseling resources on campus. The first is CAPS, which stands for Counseling and Psychological Services. They're located in the Student Services Building and are a great resource if an individual, a group, or a couple wants to talk with someone through what they're dealing with. The second resource we want to recommend is Cougs in Recovery. This is a fantastic collegiate recovery program located here on campus and works with students both off campus and on campus and provides a safe atmosphere for students that are going through recovery, in addition to a lot of other sober events throughout the year. And finally, and most importantly, we want you to know that if it is a direct emergency, to please call the University of Houston Police. All of these numbers are listed on the slide. The University of Houston Police number is there as well as you can also call 911 from campus. Thank you so much for listening. If you have any questions, feel free to stop by UH Wellness.